Have you ever been in the shower, looked down, and had that sudden jolt of panic? That moment where you notice a small bump, a slight curve, or a spot you'd never seen before, and your mind immediately starts racing. Wait, what is that? For many men, the immediate fear is that it's a sexually transmitted infection, a serious disease, or a sign that something is fundamentally wrong. This can lead to days, weeks, or even months of unnecessary anxiety, frantic internet searches that only make things worse, and a genuine fear of intimacy. The truth is, your body has countless unique variations, and the penis is no exception. It's not a perfectly uniform, factory-made object. It's a complex part of your anatomy with its own set of perfectly normal quirks. In this video, we're going to talk about 5 common things that can appear on your penis that are almost always completely normal. Our goal here is to give you clear, straightforward information to help you understand your body better, ease your anxieties, and learn to separate a simple, harmless feature from a genuine health concern that might need attention. Let's get started with number 1, Pearly Penile Papules. This is, without a doubt, one of the most common sources of anxiety for men, especially younger men. So what are they? Pearly penile papules, sometimes called Tyson's glands, are tiny, dome-shaped, pearl-like bumps. They're usually skin-colored or whitish and typically appear in 1 or more rows around the crown, which is the ridge at the base of the head of the penis. They feel smooth and are uniform in size. Now, the reason they cause so much panic is because, at a quick glance, they can be mistaken for genital warts, which are caused by HPV. The fear of having an STI is powerful, and many men see these bumps and immediately assume the worst. But here's the crucial reality. Pearly penile papules are completely harmless. They are not an STI. They are not contagious, meaning you can't get them from or give them to a sexual partner. They have absolutely nothing to do with personal hygiene or how many partners you've had. They are simply a normal anatomical variation, like having freckles on your skin. They are a type of growth called an angiofibroma, and they typically appear during adolescence or early adulthood. While some men feel self-conscious about them, they require no treatment and are not a sign of any underlying disease. They are just a part of you. If what you see are neat rows of tiny, uniform, smooth bumps around the head of your penis, it's extremely likely they are just pearly penile papules. Next up, at number 2, is something many men have but few talk about, the frenulum. The frenulum is that small, thin strip of skin on the underside of your penis that connects the foreskin to the head, or glans. You can think of it like the little piece of tissue under your tongue that connects it to the bottom of your mouth. It's a similar kind of structure. For men who are not circumcised, the frenulum helps the foreskin retract over the glans. The main concern arises when this band of tissue is a bit shorter than average, a condition sometimes referred to as a short frenulum or frenulum breve. During an erection, a short frenulum might feel tight or pull the head of the penis downwards. In some situations, especially during vigorous sexual activity or masturbation with insufficient lubrication, this tightness can lead to discomfort or even small tears, which can be painful and may bleed a little. When this happens, it's understandable to think something is seriously wrong. However, having a frenulum is 100% normal, and even having a shorter one is just a variation of that normal anatomy. It is not a disease. For the vast majority of men with a short frenulum, it causes no problems whatsoever. It's only considered an issue if it leads to repeated, painful tearing or significantly interferes with sexual function. If it doesn't cause you any pain or problems, then there's absolutely no reason to worry about it. It's just how your body is built. Moving on to number 3, Fordyce spots. Have you ever noticed tiny, yellowish or whitish spots, maybe 1 or 2 millimeters in size, scattered across the shaft of your penis or on your scrotum? These are likely Fordyce spots. They are painless, not itchy, and don't form into blisters or sores. They can appear as single spots or in small clusters. Because they can look like little whiteheads, pimples, or even the start of a rash, the fear is often that they're a sign of an STI like herpes or some kind of skin infection that needs to be treated immediately. The reality, however, is much simpler and far less alarming. Fordyce spots are just sebaceous glands. These are the natural oil glands that you have all over your skin to keep it lubricated and healthy. You have them on your face, your chest, and your back. The only difference is that on the penis and scrotum, the skin is thinner and lacks hair follicles, which makes these glands much more visible than they are elsewhere on the body. They are not a sign of infection, they are not contagious, and they are completely benign. An estimated 80 to 95% of adults have them somewhere on their body. They are a completely normal feature of human skin, and their presence on your genitals is no cause for concern. Fourth on our list is something that plays on a very common insecurity: penile curvature. The idea of a perfectly straight penis is something often seen in media, but in reality, it's more of a myth than a rule. Many men worry when they notice that their erection isn't perfectly straight, but instead has a slight curve to the left, to the right, upwards, or downwards. This can lead to a lot of self-consciousness and a fear that it will affect performance or that it's a sign of a deformity. Here's the truth: very few things in nature are perfectly straight, and the human penis is no exception. A slight, painless curve that you've had for as long as you can remember is considered completely normal. It's a congenital curve, meaning you were born with it, and it's simply due to the way the internal chambers of the penis developed. Think of a banana. They are rarely perfectly straight, but they function perfectly well. The same principle applies here. As long as the curve doesn't cause you or your partner pain during intercourse and doesn't prevent penetration, it's not a medical issue. It's just your unique anatomy. Now, this is different from a condition like Peyronie's disease, which typically develops later in life and involves the formation of hard scar tissue or plaque under the skin. That condition can cause a new, significant, and often painful bend during erections. But a mild, lifelong, painless curve is a normal variation and not something you need to be concerned about. Speaking of things that can cause real worry, while a slight curve is completely normal for many men, the deeper concern isn't about appearance, it's about performance. It's about the frustration and loss of confidence when you struggle to get fully hard, or the anxiety of not being able to stay hard. If that sounds more like what you're experiencing, then I want you to pause for just a moment. The email creatives you saw earlier refer to a special video that reveals a bizarrely simple 7-second home remedy. It's a 100% natural method that addresses the real root cause of male performance issues without pills or injections. To see it for yourself, point your phone's camera at the QR code you see on the screen right now. It will take you directly to this eye-opening presentation. Don't have your phone handy? No problem. The link is also pinned at the very top of the comments below this video. Okay, now that we've covered that for those who need it, let's get back to our list. Finally, at number 5, let's talk about prominent veins. Especially during an erection, you might notice that the veins on the surface of your penis become much more visible. They might look like a network of blue or dark lines, and sometimes they can even feel slightly raised or bulging under the skin. For some men, this can be concerning. They might wonder, is this a blood clot? Is it a varicose vein? Is something wrong with my circulation? This is another case where what you're seeing is simply the normal anatomy of the penis doing its job. An erection is all about blood flow. When you become aroused, your arteries pump a large volume of blood into the spongy tissues inside the penis, causing it to become firm. At the same time, the veins that normally drain blood away are compressed to keep that blood trapped. This dramatic increase in blood volume and pressure naturally causes the superficial veins on the surface to swell and become much more prominent. The visibility of these veins is just a matter of individual anatomy. Some men naturally have veins that are closer to the surface or are simply larger, making them more noticeable. It is not a sign of a disease, a blockage, or anything dangerous. It's a sign that your vascular system is functioning exactly as it should to allow for an erection. In very rare cases, a superficial vein can develop a small, harmless clot called a thrombosis, which usually resolves on its own, but the simple appearance of prominent veins during an erection is perfectly normal. So, to recap, we've covered 5 things that can seem alarming, but are usually just a part of your body's normal landscape: the harmless bumps of pearly penile papules, the simple anatomical band of the frenulum, The visible oil glands known as Fordyce spots, a natural and common penile curvature, and the prominent veins that show up during an erection. Understanding what these things are can lift a huge weight of anxiety off your shoulders. Knowing your body is the best tool you have against unnecessary fear. Now, it's really important to say that this video is for information and reassurance, not for self-diagnosis. Your peace of mind is what matters most. If you ever notice something that is causing you pain, a sore that won't heal, a sudden and dramatic change in appearance, or if you're just genuinely worried, the smartest and safest thing you can do is talk to a healthcare provider. They can give you a definitive answer and ensure that everything is okay. But for these 5 common variations we discussed today, you can likely breathe a big sigh of relief. If this video helped ease your mind or taught you something new, please hit the like button and subscribe for more straightforward health information. Thanks for watching.